Do ears feel soft and natural after any sort of otoplasty? Or do ears get hard?
Thank you for your question. You submitted a question without a photo, and you're asking, do the ears feel soft and natural after otoplasty, or do they feel hard after the procedure is completed? Well, I can certainly give you some perspective on how I counsel my patients who are concerned about having prominent ears in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Otoplasty is a part of the practice that I do on a fairly routine basis. And basically, I can just go over the principles of otoplasty that are probably relevant to you, even though there's no photo. But I can tell you what the assessment is like and basically what one can expect afterwards. So to begin with, in assessing prominent ears, you look at the ear from the point of view of the upper third, the middle third, and the lower third. And essentially you're looking at an area called the antihelical fold. You're also looking at an area called the conchal bowl, which is the middle part. And then the lower part, you're looking at the earlobe or the pinna. Now, the way that we make this assessment is you look at relative position of those three elements from the skull, or from the side where it looks like it's protruding more than it should. And so there are procedures that are done in otoplasty that involve basically creating the antihelical fold, and everything is done from behind the ear, and it's made through an incision behind the ear. And then the conchal bowl, which is the part in the middle that pushes the ear out to make it more prominent. That is typically, in my practice, I resect it, I remove some of the cartilage and then place the ear back against the what's called the temporal bone, so that or the mastoid bone, and actually reposition it so that the ear is now in a more natural position. And then the earlobe is adjusted depending on how prominent it is, and that's basically a skin procedure. Now, as far as the question of the feel, if you think about it and realize, like, let's say you're looking at the upper third, the antihelical fold. If right now it's not well defined, then it might feel a little bit soft and bendable. When an antihelical fold is created by these sutures from the inside, then that part can be a little more stiff, but it does not feel any less natural. It's what a normal, natural ear should feel like. The same thing applies to the middle part of the ear. Even though it might feel one way before surgery, it's not going to feel unusually different, other than because it's in a better position, the way it feels from what it was before may feel a little more stiff, but it's not going to feel unnatural. So I think that you need to meet with experienced cosmetic surgeons who do otoplasty and learn about your options. There are a lot of different variations of this operation. It's a really nice procedure for people who have been very self-conscious for having prominent ears, and it makes a really nice impact, and it really is very, very, very satisfying for the surgeon. So find a doctor that you feel comfortable with, and I think you can feel safe in knowing that in most circumstances it should heal normally. Of course, like anything, with any surgery, you have to understand the risks and benefits and potential issues like infection, scarring, and other things that are associated with any surgery. But once you find a doctor that you're comfortable with, I think you should strongly consider this procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.